Our first test for the lower extremity is analogous to Soto Hall. It won't tell us what's wrong with the patient, but it will tell us something's wrong with the patient in the lumbar spine, sacroiliac, or in the sciatic nerve distribution. Minor sign. Can you stand up, please? Positive is demonstrated here. The patient exhibits difficulty standing, indicating a possible problem with the lumbosacral joint, sacroiliac joints, or in the sciatic nerve distribution. Belt test will help us differentiate between a lumbar spine problem and sacroiliac problem. First part of the test, I'll stabilize the patient's pelvis and ask, can you bend forward to touch your toes? And then straighten up. In this position, both her sacroiliac joints and lumbar spine are allowed to move. If she has pain on this test, I'm not going to be sure whether it's lumbar spine or sacroiliac. So for the second part of the test, I'll stabilize her sacrum with my iliac crest and then say, can you bend forward? In this section of the test, because I've blocked her sacrum, she cannot use sacroiliac movement. If she has pain on the second portion of the test, I know that her complaint is lumbar spine in origin. If she only has pain the first time in the test, we know that her sacroiliac joint is the origin of her complaint. Salva maneuver is a test to reveal the presence of a space-occupying lesion, such as an osteophyte, a disc bulge, or spinal stenosis. We ask the patient to take a deep breath in and bear down as though straining with a difficult bowel movement. This is going to increase the intrathecal pressure and exacerbate compression on the nerve root, reproducing radiating pain. So our positive sign is radiating pain away from the site of lesion, which will indicate a space-occupying lesion. Can you take a deep breath and bear down as though straining with a difficult bowel movement? Once we've established the patient has a space-occupying lesion, we need to establish at what level that lesion is located. Heel walk test. Can you walk on your heels, please? Okay, you can stop. Positive sign on this test would be inability to perform the test. It'll indicate an L4 disc lesion, which is putting pressure on the L5 nerve root. Toe walk test. Can you walk on your toes, please? Okay, you can relax. Positive sign on this test will be inability to perform the test. It'll indicate an L5 disc lesion encroaching or putting pressure on the S1 nerve root. Kemp's test will let us know if the disc lesion or other space-occupying lesion is medial or lateral to the nerve root of involvement. What I'm going to do is laterally flex the patient, stabilize the opposite PSIS, and bring the patient's shoulder back into extension and rotation. Our positive sign here is reproduction of pain radiating into the leg while leaning toward the affected leg will indicate a lateral disc bulge. If the patient experiences pain leaning away from the affected leg, that will indicate a medial disc bulge, and if the patient experiences localized pain, that will indicate a foraminal compression or facet capsulitis. Straight leg raise test. You want to bring the affected leg up to the point of pain or 70 to 90 degrees. The positive sign will be pain in the posterior thigh, which will indicate sciatic radiculopathy or tight hamstrings. Possibly discogenic sciatic radiculopathy, which means we have a disc bulge compressing the nerve roots that make up the sciatic nerve. Once we've got up to 70 to 90 degrees, if the patient doesn't experience pain to here, it's most likely to be hamstrings. Lindner's test is similar to Lermit's, Brzezinski's, and Soto Hall. It involves neck flexion. In this case, our positive sign is radiating pain down the posterior thigh, indicating sciatic radiculopathy. This would be an extreme case of sciatic radiculopathy, as stretching the neck and the spinal cord all the way down and the nerve roots from inside is enough to reproduce the complaint. Turin's test. Turin's test is another test for an extreme case of sciatic radiculopathy. What I'm going to do is dorsiflex the big toe, pulling on the medial plantar nerve, which pulls on the tibial nerve, which pulls on the sciatic nerve. This reproducing the sciatic complaint would indicate sciatic radiculopathy. It's an extreme or severe case, given that we don't even have to raise the patient's leg in order to reproduce the finding. Braggard's test. If we've raised the straight leg raise test and we have an unclear positive, we bring the leg up to the point of pain. We drop down 15 to 20 degrees and then dorsiflex the foot. This will reproduce the pain or reproduce the stress in the sciatic nerve without reproducing the same stress at this level on the hamstrings. So our positive sign again is reproduction of posterior thigh pain will indicate sciatic radiculopathy. Sicard's test. We raise the patient's leg up on a straight leg raise to the point of pain. Bring the leg down 15 to 20 degrees and dorsiflex the big toe. This has the effect of stretching the medial plantar nerve, reflected into the tibial nerve, into the sciatic nerve. Reproduction of sciatic pain would indicate sciatic radiculopathy. Bonnet's test. I'm going to take the patient's leg, internally rotate, and adduct the hip. This has the effect of stretching both the piriformis muscle and increasing the length of distance between the sacrum and lumbar spine, where the sciatic nerve roots come from, and the neck of the femur, which they have to wrap around to get into the back of the leg. I'm going to do a straight leg raise toward the opposite shoulder. Our positive sign would be reproduction of posterior thigh pain, indicating sciatic radiculopathy, or piriformis syndrome. In the case of piriformis syndrome, what we would expect to see is almost instant pain getting into position as the piriformis is stretched over the sciatic nerve. If we have a mild case of sciatic radiculopathy, which is not reproduced on the straight leg raise test, because this test is more stressful on the sciatic nerve, we may only see sciatic radiculopathy and get posterior thigh pain on Bonnet's test. Firestein's test, also called the crossover sign or the well leg raise test. If we assume our patient has left sciatic pain, I'm going to raise the right leg up. Our positive sign will be reproduction of pain in the left leg. That would tend to indicate a medial disc bulge. If raising the right leg reduces pain in the left leg, that would indicate a lateral disc bulge. If we have no finding, we can increase the stretch by dorsiflexing the foot at the top of the straight leg raise. Femoral nerve traction test. We're going to ask the patient to lie on her side. We're going to tuck her chin, which stretches the spinal cord from above. We'll bend the knee, which stretches the femoral nerve around the knee, stabilize the lumbosacral joint, and bring the knee into extension. Our positive sign is pain radiating down the front of the thigh, nerve roots which make up the femoral nerve, or essentially a femoral radiculopathy. To Nell's foot, we're going to take our reflex hammer and tap behind the medial malleolus. This is tapping on the medial plantar nerve. If we reproduce pain which radiates into the big toe, second toe, third toe, and medial half of the fourth toe, this will indicate the presence of tarsal tunnel syndrome. Morton's test. We're going to approximate the metatarsal heads, squeezing together. Our positive sign will be pain between the metatarsals, which indicates metatarsalgia or neuroma.